Hello, and welcome to today's webinar, Breaking Through Burnout, Mindfulness Practices for Self-Care. This webinar is paid for by eMindful, a company that develops evidence-based online mindfulness training programs in the areas of stress, obesity, chronic pain, stress-related health issues, smoking, cancer, and more. Some important points before we get started. APA does not endorse any products or services, and the views expressed in this presentation are those of the presenters and do not reflect the views or policies of the American Psychological Association. Next, this program will not be offering CE. Let me repeat, we are not offering CE. During the duration of our time together, you will be on mute. You can communicate to us using the questions box located in your webinar control panel. We also have handouts for you to download. You can access them in the handouts box, also located in the webinar control panel. These can be downloaded at any time during the presentation. If you have any trouble downloading them, don't worry, we'll email you the handouts along with the recording in about a week's time. If you have a question for our presenter, type it in using the questions box located in your webinar control panel. Now allow me to introduce myself. Hello, my name is Dr. Rebecca Schwartz-Mehta, the moderator for today's presentation. I'm an assistant professor of clinical psychology at the University of Maine, former co-chair of the APA Advisory Committee on Colleague Assistance, or ACA, and current member of the APA Ethics Committee and the APA Work Group on Trainees with Problems of Professional Competence. You can learn more about me and our presenter by downloading our biographies from the handouts box in your webinar control panel. So now, without any further delay, let me happily introduce our presenter, Dr. Ruth Wolever. Dr. Wolever is Director of Vanderbilt Health Coaching at Vanderbilt University Medical Center. She is an associate professor in physical medicine and rehabilitation, psychiatry, and behavioral sciences and nursing at the Vanderbilt University Schools of Medicine and Nursing, and serves as the Chief Science Officer for eMindful. Welcome, Dr. Wolever.
Thank you so much, Becca. I really appreciate that. So if you'd go forward for me, just want to provide some disclosures for you. It's through my work with eMindful that I get the great opportunity to be with you all today. That's the most important of these disclosures. The other ones just do give you additional information about me. Next slide. So we're going to be talking about burnout today, and I just want to be clear that, and you probably already know this since you're here, but we are all incredibly vulnerable by virtue of the work that we do and the current status of our society. We are all vulnerable. Next. So the objective is to provide you with some skills today and an opportunity to practice so that you end up with an experiential understanding of a way to deal with that stress. And all of the things that I'll be showing you today are mindfulness tools. I want you to be able to experience what mindfulness is and to understand it really through that experience. I'm hoping that during the practices, you will get a good felt sense of how mindfulness can be used to interrupt all sorts of patterns that lead us to experience distress and that create a whole bunch of conditions. And hopefully you will leave with some very specific practices and plans to use those practices to improve your own self-care. I also hope that you'll leave with a little bit of a conceptual understanding of the kind of brief overview of what we know from a research perspective. But the focus today is really going to be mostly on practice. So let's settle in. I would invite you to check your environment to ensure that it's as private as possible for you. The door is closed. There's less sound except for the sound coming from this particular webinar, and that you're able to position yourself in a comfortable manner, but also one that'll support you staying awake. If you're comfortable to close your eyes, I invite you to do that. If you prefer to leave them open, just find a spot on the ground a few feet in front of you and allow yourself a gentle gaze. We're just going to begin to work with our attention. So you might notice the points at which your body makes contact with the chair or whatever you're seated upon. Perhaps you get a sense of the texture of your clothing against the chair, or maybe the pressure of your sit bones. The sensation of the support holding the body. And you might also notice sensations in your feet now as they're connected to the ground. Just giving you a sense of the foundation of the earth beneath you. Just observing where on your feet you feel more pressure. Might be the inside or the outside. More toward the front or the back of your foot. And just get a sense of whether you can feel each one of your toes. So noticing the body resting, the feet on the ground. You might also just check and see if you have a long spine. And just allow your shoulders to rest. Your head to relax. And gently bring your attention now to the breath. You don't have to make anything happen or do anything in particular. You're just training the mind and noticing the experience of this particular breath. You might observe whether it's short or long. Smooth or choppy. And just getting a sense of where in the body the breath is most obvious to you. Some people notice right at the tip of their nose. Others feel it more in their throat. Perhaps you notice it in the upper chest. Or your ribs at the sides. Or maybe you feel it in your belly. Wherever it is you most obviously find it or it's most salient, just allow yourself to rest a hand there. Just giving you another attentional anchor. If your mind wanders away, just notice that. Not criticizing or judging, just observing and gently recentering on this breath now. And then allowing yourself 2 or 3 full, comfortable breaths. And expand your awareness now back into our group experience. And on the next slide, Peggy is going to launch a poll for us so we can get a sense of what people in our group are experiencing. So just let us know now. What did you notice about your own mind, about your body at the start of our practice? You can select as many options as appropriate for you. Hit the submit button. We'll just get a sense of similarities or differences in experience. Were you observing a mind that was busy? Were you able to settle the focus and keep it in the body? Did you experience a sense of relief at all? Or did you find a sense of stress because you have so much to do? Or perhaps you felt a pull, a desire to answer email or text or optimize use of these moments in some other way. Whatever you found, we'll go ahead and close the poll and Peggy will show us our results. So it sounds like at the start of the practice, the majority of people really experienced a pretty busy mind, and roughly a third did sense relief and also stress. So a pretty combination. Sounds quite like real life. So we'll go on to our next poll, just so you'll get a chance now to see if at the beginning of the practice there was anything different than at the end of the practice. So on the next slide, as Peggy launches the second poll, I just want to talk to you for a moment about what mindfulness is. Take a moment first to answer the poll. The difference this time is basically about the change. So At the end of the practice, what did you notice about your own internal experience? A busy mind, hard to focus. You noticed your mind wandered and you brought it back as many times as you needed. Perhaps you felt more present and relaxed than you had a few minutes earlier. Perhaps you experienced a greater sense of stress. And maybe you continued to feel a strong pull. So Peggy, we can close the poll and go ahead and put the results up. It looks like this group was really able to notice quite a shift in a really brief time. So in this 6.5 minute practice, it seems as if the majority of people were able to continue observing the mind's very common tendency to wander and to notice and bring it back. And also experience the ability to be more present and relaxed. Of course, the mind is very busy, and that continued for some people, and the pull of work also continued for some people. So going back to our slides, let's just talk briefly about mindfulness and its definition. So Jon Kabat-Zinn, who really is the person who's kind of credited with advancing mindfulness in a secular dimension here in this country, defines mindfulness as the awareness that comes from paying attention in a very particular way. And that way is on purpose, so it's intentional. It's volitionally directed attention. Paying attention on purpose in the present moment. So it's about what's going on right now. And doing it in a way that you really can collect data, that you basically can see what is without elaborating it, telling a story about it, judging it. And doing all of this in a particular way with an attitude of curiosity and kindness and presence. So this basically is cultivating present moment awareness. So we'll go to the next slide and then the one after that as well, so we can get to the focus on the present moment. So as I'm sure you're aware, we spend a great deal of our time thinking about what's up ahead, planning for the future, perhaps worrying about it, or we spend time focused on the past, perhaps replaying something that didn't go quite as we wished, or remembering and savoring something that was marvelous. And we actually spend relatively little time in this present moment. And the way that we divide our attentional resources, interestingly, the way is driven by many different things that we're going to touch base about. Next slide. Mark Twain said, "I've had a lot of worries in my life, most of which never happened." And I'm sure you've had clients and have probably tuned into yourselves as well. Notice that we can imagine up all sorts of things that often are actually not true, although they feel extremely true. And our bodies respond as if they are. Next slide. So we're going to continue practicing so that we can get more and more skillful at being able to direct our attention where it's most useful to us. So I invite you to, again, get into a comfortable position. Close your eyes or find a spot on the floor out in front of you. And allow your gaze to be very soft, gentle. And just take 3 comfortable breaths. And now what we're going to do is a very brief body scan, where we're in essence going to attend to various places in the body that we may or may not have visited today. So let's start with the tip of your toes. And just like our previous practice, you don't have to do anything particular. The invitation is just to notice. When you're directing your attention to your toes, what do you feel? What sensations are there? And what about your arches? Both the tops of your feet and the bottoms. Gently bringing your attention on up through the ankles. Through the lower legs. And the muscles of the calves. Moving your attention through your knees. To your upper legs. The powerful muscles there that allow us to do so much with our bodies. Get a sense of both the muscles on the back sides of your legs and also the top. Those and the tendons down the sides as well. It's getting a sense of the sit bones now. And your hips. Just feeling into this lower part of your torso. Gently moving your attention on up to the lower back, your waist and abdomen. Into the middle of your torso, the middle of your back, your chest, on up to the top of your chest, your upper back. And just allowing yourself to observe, being gentle, noticing what's here. Attending now to your shoulders. There's the upper back leading into the shoulders, the upper chest leading into the shoulders, and the tops of the shoulders. And just noticing what happens if you gently settle your attention here. And moving your attention also down your arms. Through your elbows, your forearms, all the tiny spaces in your wrist and your hands. And observing how each of your fingers feels. Attending now to the neck. Both the front of the neck, each side, and the back. So many long, thin muscles do such important work. Observing how it feels to move your attention now from your neck to your jaw. Your mouth, your nose and cheeks, your ears and the sides of your head, on up the back of your head and scalp, as well as up your face, around your eyes, your temples and forehead, and the top of your scalp. And then taking a moment to attend to the body as a whole. Just to notice if there's any part calling for more attention. And then directing your energy and attention there. If you like, you can also feel the breath in your torso, expanding and releasing. So giving yourself full presence for the next 3 breaths. When you're ready, bringing your attention back into our group. And Peggy will move the slide for us. Just wanted to show you that you will have directions for doing these, although you now know how to do it if you didn't before. And the next slide is going to ask you to provide a little information, again, about what you're noticing. So what are you observing about your own internal experience? The state of your mind, the state of your attention, anything you found about your muscles, and then we'll go ahead together and take a look at the results of that poll. So this particular practice, the body scan, is a little different than the first practice. Looks like about a third of the people were experiencing a busy mind, and this is not a mutually exclusive poll, of course. 59% noticed the mind wandering and were able to keep bringing it back. About a third were able to be absorbed in the experience of the body, and looks like 43% noticed something, that tightness or something about their muscles that they had not been previously aware of. And similar percentage was able to actually release some of that tension. So moving back to our slides then, I want to talk a little bit about what happens in this experience. So, you know, we humans have two ways of processing information. I'm obviously being overly simplistic, but we have two information processing systems. One is a bottom-up system and the other is top-down. So the bottom-up system is basically the non-conscious functions of the body that occur for efficiency and also for survival. So these are the places that drive the functions of alerting, orienting, monitoring, not only the environment, but the internal world, monitoring what's going on inside of ourselves, and also monitoring for homeostasis. So autonomic balance, the stress axes, the relaxation recuperation response, and how that's both the stress side and the relaxation recuperation side balance each other out. This is all part of our bottom-up informational processing system, our perceptual processing system. And what happens is that sensory information comes in, travels from all of our senses, the main ones, of course, sight, sound, touch, smell, taste, also balance and movement, kinesthetics. And all of that sensory information comes in, you know, to some primary cortex in whatever part of the brain is relevant to create a percept. And that gets associated with contextual clues and memory. And it's all outside of our consciousness, depending on what's happening with our attentional gates. So our attentional gates regulate what information from the system is allowed to move into our awareness. Next slide, please. We also have this top-down system, which is our cognitive information processing system or conceptual information processing system. So that's the system that is highly supported in the West. That's what we use a lot in school and the way that we train. And it's basically the top-down system that meets the bottom-up system. It takes what's in our awareness, it labels it, it organizes the information. It's what we intentionally are able to do. And one of the things that's so cool to me personally about mindfulness is that it's the only training system where we're really working with these attentional gates. And it's so powerful because we are working with both information systems. Next slide, please. So mindfulness has been shown to improve all of the top-down functions that have been studied and a number of the bottom-up functions. So working specifically with how these percepts connect and associate with other aspects of memory and contextual cues and each other, and what is actually allowed into consciousness to be worked with. And of course, it depends on the experience level of the practitioner. It depends on the length of training, the various kinds of mindfulness training. It depends which practice you're engaging in, etc. But so, for example, novice meditators are able to quickly begin to see shifts. The neuroscientists are able to quickly measure shifts in their ability to orient. Like, you get better and better at orient or directing your focus. Much more expert meditators are able to demonstrate shifts in increasing awareness in the periphery through open monitoring practices. And so we're not going to get too lost in neuroscience here, but I want you to at least have the experience of, wow, I got into my body in terms of attending in a way that may or may not be typical for you. And I want you to know conceptually that you were actually working on training a bottom-up system, a perceptual information processing system. Next slide. So now that I've moved your attention up to the conceptual information processing system, let's move it back down. Our next practice is an awareness of breath practice. And it's basically, we're going to sit together for 10 minutes or so. And I'm going to invite you once again to find a comfortable position. Allow your eyes to close if you'd like, or allow yourself to soft gaze a few feet in front of you, if you prefer that. And you might just notice any differences in the experience as you pay attention now to where the body makes contact with the chair or the floor or wherever you're seated. If you'd like to very gently shift your weight, you might just notice those tiny changes in sensation. Settling again to have a long and alert spine, a dignified spine, as many teachers call it. And also grounding again to the earth, noticing contact with the floor, your feet on the ground. And then I'd invite you to bring your attention to the tip of your nose and the sensation of the breath moving in and out of the nose right here. You might want to rest one of your hands right below your nostrils, just so you can get a sense of the temperature and how it changes between an in-breath and an out-breath. You might rest your hand on your upper chest. Just helping to anchor your attention right here. To really sense the in-breath as it lifts or expands your chest, and the out-breath as the chest falls. Or you may rest your hands on your sides at your ribs. Just to help you notice if there's any movement here with the breath. You might even feel your back if you're leaning against a chair. And notice as the breath moves in, how even the back expands. Again, you don't have to make anything happen. You're just noticing these tiny, subtle changes. Or perhaps rest your hands on your abdomen. Just noticing how the belly expands to make room for the breath. How it releases back toward the spine on an out breath. And so resting your hands wherever they're most comfortable. Now just choosing where the breath is most salient. And seeing if you can follow 10 breaths at this point of focus. If you lose your count or something pulls your attention away, just notice that. Again, not judging it or criticizing, just observing. And then gently guide your attention back again. If you're having a hard time settling, begin the count again. You're just training your mind to stay right here, to experience this breath. This particular breath. So whenever you're ready, allow yourself 3 deeper breaths now. And if your body is asking for any particular kind of a stretch, feel free to do that. Perhaps your neck or your shoulders, whatever it is that would feel helpful to you and your body. Next slide, please. So I'm going to invite you to bring your attention back to the webinar. There are some directions for what we just did. Next slide, if you decide to print the slides off for yourself. And I just want to talk a little bit about some of the experiences that you may or may not have just had. So much of our reactivity in the world is triggered by cues. They might be external. There are also a number of internal cues, which of course as psychologists, I'm preaching to the choir here. And they trigger very habitual patterns. These are patterns of perception, patterns of thinking, patterns of emotion, even patterns of action. And as we do them over and over and over again, they become reinforced and are typically moved outside of our awareness, or may never have moved into it in the first place. It's kind of like grooves in a record, if you're old enough to know what a record is. Next slide, please. And these grooves, as we make them deeper and deeper, are basically neural tracks, right? So tracks running through the brain and nervous system. And the more our individual percepts are glommed together, if you will, they take on the perception of a single thing. So for example, this photo on the slide is a bait ball, if you're not familiar with bait balls. And it's made up of hundreds and hundreds and hundreds of tiny fish that, as a survival strategy, get together and swim in a particular pattern as a source of protection to make themselves look big to predators. So when you first glance, it seems like it's a single thing, but it's actually tons of different little fish. So it's actually micro experiences put together to seem as if it's one. Next slide. I think a nice way to consider this is a model that I learned from Sasha Loring, who wrote the Fierce Kindness, oh dear, Eating with Fierce Kindness is the name of it. And one of the nice ways to think about the mind is that, you know, we have this constant chattering. Top level of the mind is just constant. It's a running dialogue about everything we're experiencing, just sort of narrates our world. But if you're able to settle it, underneath it is a bait ball, if you will, a conglomeration of individual thoughts, emotions, sensations, and behavioral urges that connect together and drive behavior. When you're able to settle enough by training your mind through practices like mindfulness meditation, you begin to see and are able to actually track the rise and the fall of sensations, emotions, thoughts, how they work together, how they push or develop a push toward a particular action. And if you are a really experienced practitioner, you're able to settle way beyond that to full open monitoring and access to really the most wise part of existence. Next slide. So mindfulness, one way to think about it, is a tool to help interrupt the automatic pilot, the habits that we've created for how we perceive, what filters we use when we perceive, how we think, how our emotions become connected to various thought patterns, etc. Next slide. And this process is basically self-regulation. We have lots of data at this point about the use of mindfulness meditation to enhance a number of self-regulatory processes in lots of different kinds of conditions: stress, anxiety, recurrent depression, chronic pain, substance abuse, binge eating, ... Next slide. All of these self-regulation processes, of course, are what are so important. I'm sure you know from your work with your clients, right, that part of the challenge is helping people to better self-regulate. So a way that it's been very helpful to me personally in understanding this is Michael Boehm as his model. He's an amazing mindfulness teacher at Penn. And if you think about mindfulness and the role of managing stress, you know, stress is what happens when you have the event, and the event could be external or internal, and the reaction, and there's a collision, if you will. And mindfulness is this space that can be created to slow the whole process down and to actually allow space for us to be able to observe what's happening and make wiser choices that we don't even experience as possible when we don't see them. Next slide. So there are three basic types of practices to cultivate mindfulness. There are focused attention practices, open monitoring practices, and a number of cultivation practices. So focused attention practices, different kinds of concentrative meditations, where basically you are training the mind to create a stable attention system where you're able to orient where you'd like and focus, keep and maintain that focus there, and simultaneously get stronger at dealing and at keeping that stable focus and recognizing from an observer stance when you run off and are elaborating what is in the basic perception. So we take a sensation and create a story around it, or a thought and elaborate it. All of the, when you develop a fully absorbed ability to concentrate, you can do it with many different objects. The breath we were using today, we used various aspects of the body as well. If you think about other kinds of meditation that have, you know, early TM practices have a mantra to focus on. But then there are additional open monitoring practices and multiple meditation traditions, including TM, have open practices as well. And that's what's known as insight meditation. And it's basically learning to drop the object of attention and hold a full field of awareness that's open to whatever arises in your internal experience. Depending on your practice and your skill at this, you may have gotten to an open monitoring practice in what we were doing, but you have to be a pretty significant meditator to have experienced that from what we've done thus far. But I do want you to understand there are these sort of two kinds of practices. And mindfulness trains you first to have the stable attention, because you can't get to open monitoring without it. Once you have it, you're able to practice open monitoring, refocus, open monitoring, etc. And then the third set of practices is cultivating qualities like compassion and forgiveness and loving kindness, basic attitudinal components to mindfulness. Next slide. So we're going to do a really brief practice now that's very helpful in a number of circumstances, but two particular ones. One is when you only have a minute, and the other is when you're having a really hard time settling your attention. The more anchors, the more easy it is to settle attention as you're training. And so if you have a really hard time in whatever awareness of breath practice, for example, then counting the breaths can be very useful. So what we're going to do now is count our breaths from 1 up to 10, and from 10 back to 0. And I'm just going to show you briefly and then let you go at your own pace here, since we all have different breathing rates. It's really like 20 separate meditations. Each breath I want you to gather all of your attention as much as you possibly can to fully experience that particular in-breath or out-breath. So what you'll do is say to yourself, breathing in, 1, breathing out, 1, breathing in, 2, breathing out, 2, on up to 10, and then back to 0. So I'll start us and then just ignore my voice and go at your own pace. Letting your eyes close again or find a gentle spot to rest. Breathing in, 1, and out, 1. In, 2, and out, 2. And find your own pace, whatever it may be. If you lose count, just begin again with this breath. And if you're not quite done, just join whenever you are. Move on to the next slide, please. That brief practice is just a quick way to ground. And of course, the more you've trained your mind to settle, the more useful those brief practices will be for you. So I'm going to move our attention back up again to the conceptual information processing model. There's been an enormous amount of research that has presented itself in the last 17 to 19 years. They can just get a sense of the trajectory. This is the number of studies of mindfulness in the peer-reviewed literature. Next slide. And I want to just point out that studying mindfulness is pretty complex because there are many different ways to think about it. 33 or 34 definitions in the published literature. Sometimes mindfulness is used to describe a state, sometimes to describe a trait, sometimes to describe a type of meditation, sometimes to describe a particular practice or set of practices. And the measurement tools are evolving rapidly, but of course, mindfulness is not directly observable. And so the tools are really trying to tap very nuanced constructs. There are a lot of constructs involved, and it's very difficult to separate them out or take them apart. So for example, if you wanted to study acceptance and the cultivation of acceptance through mindfulness training, you know, in order to hold an accepting stance, you need to be able to develop present moment awareness. You have to have an object of the focus. You have to be able to decenter using ACT language there, or to step back and observe, as well as cultivate the attitude of acceptance. So a lot of things are going on, even though what you think you're measuring is acceptance. If you want to study, for example, sustaining attention, you have to be able to alert, orient, and sustain in order to do that. So I just want to underline that it's a complex field. And it's also really hard to separate out techniques because, for example, the awareness of breath practice, depending on where an individual is in their training, where an individual is on a given day, in a given moment, independent of their training, there are so many things that are going to influence which processes are most being trained. And so there are a number of mechanisms involved in each of these techniques. Next slide. Despite that, there's some really exciting research out there that I just want to mention a few little pieces of. So keeping in mind that mindfulness is many things, many tools, if you want to think about it in the tool world, and it's also a way of being and a way of living. So I just want to keep underlining it can be many different things. To complicate things, or perhaps make them more interesting, mindfulness-based interventions themselves are highly heterogeneous. So an MBI, a mindfulness-based intervention, is a set of systematic practices that's designed to develop and nurture present moment awareness, intentional awareness, and kind awareness. Next slide. And there are different kinds of MBIs. So mindfulness-based stress reduction is the one that was originally created based on a number of practices that Jon Kabat-Zinn secularized, starting in the late 70s. MBCT, mindfulness-based cognitive therapy, now has certainly evolved a lot since the early 90s. There's mindfulness-based eating awareness training, mindfulness-based cancer recovery, mindfulness-based substance relapse prevention, ... There's a number of them out there. And so studying them is also challenging. But we do know from a number of studies that mindfulness-based interventions are consistent in showing small to moderate effect sizes for mental health providers in a number of things that are very beneficial for us to decrease, like stress, anxiety, rumination, number of aspects of negative affect, while also improving a number of things that are very helpful to us as individuals, and also particularly in the work that we do, like self-compassion, calm, positive affect, empathy. There are these improved psychosocial measures basically translate into increased capacity in the therapeutic encounter. The literature suggests that people who practice mindfulness are able to attend to their own experience and that of the client or patient in different ways. And that is, interestingly, there's not a lot of research yet on patient outcomes, but there is some that is linking improved patient outcomes to therapists as a function of their level of mindfulness training. There's quite consistent evidence for mindfulness-based stress reduction interventions that shows that increased mindfulness and decreased stress are related. And within the MBSR literature, it's also indicative of supportive, but the findings are not as consistent for showing beneficial effects on burnout, on self-compassion, and a number of factors in psychological well-being. I have a lot I can tell you if you want to take the burnout research apart a little bit, because it is also a complex literature. But let me stay at the high level for a moment here. Next slide. There is also research, but considerably less, on mindfulness-based cognitive therapy for providers. It's very consistent in showing increased provider mindfulness, but it is not as consistent in showing well-being. There's a little bit of work on ACT, acceptance and commitment therapy, which is not strictly a mindfulness-based intervention, but does have a mindfulness component to it. But it also is doing a lot of other things. So there are some interventions also that increase mindfulness without specifically targeting burnout, and others have shown associational studies that have shown that providers with greater increases in mindfulness simultaneously display greater reductions in stress, greater reductions in burnout, and increases in well-being. And the indirect benefit, of course, includes positive effects on the kind of work we do on therapeutic alliance and empathy. And there's some evidence as well for enhanced perceptions of efficacy in work. Next slide. So I wanted to give you just a quick taste, and I'd like to check in with you now to see how you'd like to spend the rest of our time. So I can either tell you more about the research, or we can do another practice and talk about weaving some informal practices into your day. So please answer the poll in front of you. Just let us know what your personal preference would be. And we're going to take the majority vote on this one. So Peggy, you could go ahead and close the poll, please. All right, it looks like we have a little majority on focusing mostly on practice. So we'll go ahead and do another practice or two. Peggy, if you would skip ahead to slide 62, that would be great. And let me tell those of you that are most interested in the research, if you print out the PDF of the slides, there are 20 or 30 detailed slides and 3 full slides of references that will give you a very good sense of current, updated state of the literature. The literature's young, but it's extremely positive. So we've done a number of formal practices, and a formal practice is a regular, intentional commitment of training the mind through this practice where your attention is focused on this moment. You may have different targets of attention, but training to be in the present moment. So we've done today an awareness of breath and a body scan practice, and we will do a loving kindness meditation then in just a moment. There are also movement practices where you're cultivating the exact same skills while moving, walking, stretching, certain kinds of yoga. Next slide. But I also want to point out informal practices, ways of cultivating awareness in all of your activities. You certainly practice this and trained in graduate school in being able to stay present and really listen to a client. taking that kind of attention and imbuing it through this training process into other areas of your life so that you can cultivate it across chores, across activities, driving, eating, grooming, whatever it is you're doing. Next slide. There are, let's go past this one, please. So my suggestion would be to try linking it to something. Choose something for yourself, like brushing your teeth or getting dressed in the morning, or getting undressed in the evening, or getting into your car, or escorting your client back to the office, logging on to email in the morning, pouring your first cup of tea or coffee. Pick something, one thing, and I would invite you to try to really attend to the internal experience of doing that activity on a daily basis for the next week. That's a process of training that can be easily built in to your day. Now, the next slide and the one after that, there are a couple of lists here. We're not going to go through them all, but there are many things you can do as part of an informal practice. Connecting some particular chosen behavior as a cue to help remind you to bring your attention into the present moment. Next slide. So these are all ideas. Again, they're in the handouts if you'd like them. Some particularly useful ones. You're going to have time stopped at the red light. You're going to have times waiting in line. All of these informal practices are significantly supported by a regular formal practice. Next slide. So let's do a loving kindness meditation now. It's a particular one to foster self-compassion as well as compassion. And you always begin with yourself, filling the cup before you serve others. So once more, I invite you to get into a comfortable position. Recenter yourself and allow your eyes to close and take 2 or 3 comfortable breaths. Now I'm going to offer phrases. Feel free to change them if you don't like the ones I choose. You're just going to repeat them to yourself quietly. May I be happy. May I be healthy. May I be free from suffering. May I be safe. May I be happy. May I be healthy. May I be free from suffering. May I be safe. May I be happy. May I be healthy. May I be free from suffering. May I be safe. And now choose someone you love, someone dear to you, and imagine them in your mind's eye. As you offer them for that person. May they be happy. May they be healthy. May they be free from suffering. May they be safe. May they be happy. May they be healthy. May they be free from suffering. May they be safe. And extend that now to others that you care about, family, friends, colleagues. May they be happy. May they be healthy. May they be free from suffering. May they be safe. Expanding it to our practice group today and all helping professionals. May we be happy. May we be healthy. May we be free from suffering. May we be safe. And to our clients and people everywhere. May they be happy. May they be healthy. May they be free from suffering. May they be safe. Next slide, please. I'm going to stop us there. When you practice this, you pick phrases that are meaningful to you. And because we had a short time for the practice, I left out an important part. When you've got some experience with this under your belt, it's also useful to send that to somebody that you're having difficulty with. Next slide. So let's go ahead and skip this poll so we can allow for some questions. And I will just invite you to consider what informal practice you're going to do for the next week, as well as which of the practices we did today you choose to do for yourself in the next week. There are a number of resources associated with the program that you can download, and specific from eMindful, in addition to the slides from today, there is a flyer or one-page description of the program that we have for providers. It's an excellent program. It's a program that is self-paced as opposed to being live. So you can use, there's a particular order and sequence. You can read about it, but you can, if you want to go at your own time, if you want to spend whenever it's most convenient for you, that is a recommendation. eMindful Life is a program that we developed for people that want to practice in community. It's very helpful to have others to sit with that are working on the same kinds of things. And you can join it for 2 weeks for free to try it out, see if it's of any interest to you. And then there is also an affiliate program that you can find out about at this link. Our affiliate program basically allows you to embed links to our entire portal and suite of many different classes in a way that's useful to you and your clients. It's to serve your clients. But I'll let you check that out on your own if you're interested. And APA's advisory council or advisory community on colleague assistance, the ACCA, that Becca is representing for us today, also has created some fabulous resources, and links to those were also available and downloadable. So Becca, I'm wondering if you have a question or two that were particularly interesting or perhaps particularly repeated that might be useful.
Yeah, we've got some great questions from our attendees. We had many questions focused on navigating the intersection of therapists' own distress, whether that's illness, fatigue, burnout, being triggered by our clients, or even vicariously traumatized by the content. And clients' own distress. And several are asking how we might use mindfulness as a self-care strategy to kind of navigate that intersection of our distress and our clients' distress.
Yeah, so I think that the laying the foundation for it, my recommendation is to have a practice of your own and a community with which you practice. You know, training the mind is like training anything else, right? You're not going to be great at it if you do it once every 6 months. So coming up with something that you can realistically do, even if it's 5 minutes, on a repeated basis, a daily practice, if you will, even if it's 4 times a week, 5 times a week, but something that you have a serious commitment to, so that you have a foundation to manage your own distress. That makes you more available and able to navigate the interaction much more skillfully. Some of the research actually shows that the psychologists that practice are able to not react to their clients' level of distress and emotions. Not just that they're great compartmentalizers, but literally don't have as much emotional reactivity to it, which keeps them more in the in a role of being able to more skillfully help the person navigate. They interestingly are also able to express more empathy because their own stuff isn't getting in the way as much. So take whatever practice resonated with you today and do it on a daily basis. For me personally, I have to have a community to practice with to really ingrain the habit. So even though I've been doing it for years and years, 24 years now, I have a group that I sit with, and that's just incredibly important to me. When I stop hanging out with others to practice together, it drifts. So I also find that it's very helpful to start with a full class. And this is just my preferred way of learning. Everybody knows themselves and people can figure it out, but it can be really helpful to have a class because it gives some structure to it and a lot of support for the practice. And eMindful has a number of classes. There are others that do as well, but ours are online at multiple times in the day. The eMindful Life platform has, 10 or 12 different classes a day, 14-minute practices and 30-minute practices, or you can do full, a 10-week program, a 12-week program. MBSR is typically 8 weeks. So that's my strongest recommendation. Consider it as a really important part of self-care, just like you do tending to your exercise, tending to your nutrition, tending to your sleep. Hugely important.
Great. Yeah, that's wonderful. We had a couple of questions about whether mindfulness might ever be contraindicated for certain client populations, or even a couple of questions, asking, well, what if mindfulness just doesn't seem to work for me? Could you
Yeah,
speak a little bit about that?
great question. I appreciate that. I appreciate it. So where mindfulness is contraindicated, um, is for people that have a strong tendency to depersonalize, and in particular, also for people that have thought disorders, right? So I don't think there's anything that suggests this is helpful with people that are psychotic. Um, the group that has really found uh, problems are people that have practiced super intensely, as in multiple hours a day, that got to a kind of state of depersonalization. It's extremely rare, but it does happen. So I would suggest that be, a caveat. If you're, I wouldn't get to a place where you're practicing hours a day without a significant mentor and a lot of support. But for the vast majority of us, and kind of, I don't know what normal is, but if you're practicing um, an hour a day, if you're practicing 10 minutes a day, if you're practicing 30 minutes a day, you're actually going to experience a lot of positive changes. That's the only contraindication that I'm aware of. Like
Okay.
with anything else, when you create space to tiptoe through your non-conscious things, things may arise, right? Trauma may arise, but that's totally true in lots of situations.
Right, absolutely. Yeah,
Yeah.
sometimes just being aware of what's there, maybe what's there is that you're upset, or or there's some stuff to deal with. Um, Great. And I think we have time maybe for, oh, no, I'm looking at our messages here, and I think we have unfortunately run out of time. So thank you, Dr. Woolover, for that excellent and engaging presentation. As you went over, APA has web resources, articles, books, and journals, and of course the great eMindful resources that you reviewed. Thank you so much for joining us, Dr. Woolover, and thank you to all of our listeners for your participation. We'd also like to especially thank eMindful for making this webinar possible. A recording of this presentation will be emailed to everyone within a week's time, and the recording will include links to the handouts in case you've had any trouble downloading them today. As soon as the webinar has ended, a short survey will appear on your screen. We hope that you will take just a few minutes out of your busy day to take the survey and give us some feedback on how we did and how we might improve. We thank you again for your attention and hope you have a wonderful and very mindful day moving forward. Thank you.